The Judiciary's commitment was announced yesterday during the health camp organized at the High Court and Magistrate Court in Fort Portal.
There is development and sensitization of staff of the Judiciary on HIV/AIDS and work policy. That also will be part of what we are doing today. There is medical financial support provided on quarterly basis to staff who declare their HIV status.
Kachai Prosi, who represented the chairperson of the AIDS committee at the health camp, stated that the judiciary recognizes the impact of HIV/AIDS on individuals and communities, insisting that they are dedicated to upholding the rights and dignity of all individuals affected by this disease.
We are here to provide an enabling environment for elimination of all forms of HIV and AIDS-related stigma and discrimination in the judiciary. We are also here to increase involvement and participation of staff of the judiciary and other actors in the implementation of interventions to reduce stigma, discrimination, and high infection rate in the workplace.
Additionally, the judiciary plans to collaborate closely with healthcare providers, civil society organizations, and government agencies to strengthen the legal framework surrounding HIV/AIDS prevention, treatment, and support. The partnership aims to streamline legal processes, reduce stigma and discrimination, and ensure that individuals affected by HIV/AIDS receive fair treatment under the law.
The awareness sensitization both for HIV and non-communicable diseases. We appreciate and welcome all the people who have come to minister to us in this area of our health. I re-echo the suggestion of this worship, the registrar, that we need to do exercises. All of us now have sat for more than 2 hours, and health-wise that is not good.
Amy Vincent Mugabo, the Fort Portal senior resident judge, said that by integrating HIV/AIDS related considerations into its legal practices and procedures, the judiciary seeks to contribute significantly to the overall goal of ending the HIV/AIDS epidemic by 2030. Mugabo also reveals that this will enable judiciary officers on how they can deal with the disease involving sexual and gender-based violence.
Most of us have been dealing with SGBVs, and some of these perpetrators are HIV, and they have a very high risk of transmitting this HIV to the young ones. So there's need to ensure that all our health facilities have PEP.
There was an increase in infection rates, which previously stood at 14.6% and placing Fort Portal in the second place after Kalangala district with the highest infection rates in the country. The same records from Uganda AIDS Commission between January to December 2022 also indicate that a total of 1,433,000 people are living with HIV in the country, with 858,000 being women and 495,000 being men, while 80,000 are children. In the same period, data indicates that 17,000 people died from HIV-related illnesses, with 6,300 being women, 7,100 were men, while 4,000 were children.
Everyone knows how we are standing. So for us, it is more important than any other district. If we are not the best, then we are second. But being the best, not in the right way, but in the wrong way. As leaders of Fort Portal, we are committed to change the status quo. And I once again thank the judiciary for coming to join us in lowering our prevalence rates.
Businje Emma, the Fort Portal Deputy Resident City Commissioner, says the biggest problem affecting the fight against AIDS is ignorance.
Awareness, because I believe the biggest problem we have had as a country, as the world, is ignorance. Most of the diseases we are suffering from, the community members are suffering from, are due to ignorance, lack of information.
Betty Mujungu, the Fort Portal City Deputy Mayor, called for a change on transfer and sharing of the messages on the disease and called on them to instead use more of social media where the youth can easily be found.
In a country where the youth, or a world where the youth are more, and yet even the messages like for HIV/AIDS are still the messages that I will consume and understand first, and not for the young people. They are more on social media, and yet these messages are told more on radio.
Mr. Pofia.